Hi again, this is Jane from Fundamental Care Training, and now we're going to have a look at using the most common forms of personal protective equipment that you will come across in health and social care, and that is gloves and aprons. Before you do anything, make sure you've washed your hands according to the NHS 20-second procedure using soap and water. Make sure they're thoroughly dried and moisturised to protect the skin. You've got the right size gloves for your hands and that you have an apron ready, and it's always a good idea to prepare it by separating it out before you put the gloves on, because it's much harder when you've got your gloves on. When you're wearing gloves in a health and social care setting, you do not need to wear two pairs, one over the other. One pair is quite sufficient as long as you are following the guidance on hand washing. And if for some reason they do become torn, take them off, replace them, but wash your hands using that procedure in between doing so, okay? So, first of all, put your apron on, because putting your apron on is a lot easier to do and tie up if you're not actually wearing the gloves at this point. So the NHS guidelines say that you should do so by tying a bow at the back, because that's easier to undo. Ensure that it's straightened out, and when you've got it in a position that you feel comfortable with, then take your pair of gloves and pop them on. Remember, you've got clean hands at this stage, so there's no issue about whether you touch the inside surface or the outside surface. When you've got your hands in the gloves properly, then go and carry out whatever task you're doing. Remember, you only use gloves for tasks where you are likely to come into contact with body fluids. So if you are dealing with sweat, blood, urine, tears, feces, any of those, you are going to be wearing gloves. If you are helping someone to eat, and you're likely to be putting your hands near their mouth, you're going to be wearing gloves. If you are giving medication, you are also going to be wearing gloves, because although you should be using the non-touch technique and not actually handling the tablets yourself, just in case, you should be wearing gloves because you don't want to be contaminated by any medication. You've got your gloves, you've got your apron on, you've carried out your task, you're now ready to take them off. The problem with that is that lots of people get into a bit of a rush and they kind of forget about some of the principles of taking gloves off. The main thing to remember is that the outside of your glove is now dirty. The inside of your glove is still clean. So you do not want to be touching a dirty surface with a clean hand, or a clean surface with a dirty hand. So when you are taking gloves off, the outside of this is dirty and the outside of this is dirty, so it's fine for this to touch this surface because it's dirty to dirty. So you can pull that off, you can scrunch it up and put it in the middle of that fist. What's not okay is for me to pinch the glove like this, because this is a clean hand now, isn't it? And now it's touching the dirty outside surface. You don't want to do that, okay? So do not pinch. What you do is you put a finger up on the inside, either like that or like that, and you pull the glove so that it turns inside out. Now what you've got is a glove inside the other glove, which means that you've got a clean hand here, you've got a clean surface here, and it's okay to touch it all. The next thing to do is to take your apron off. What you don't want to do is pull your apron from the back and put it out like this, because any contaminants that would have been on the front of that apron have now been shot into the air, which undermines the whole point of wearing the apron. So I'm going to show you how to take an apron off safely in accordance with the NHS guidelines. So now I've got my nice shiny apron on again. I've got my used gloves in my hand here. I will, with this uncovered hand, I will take this strap over the top of my head. Now it's okay for me to touch this part of the apron with a hand, because this part of the apron is at the back and isn't likely to have become contaminated with anything. So the NHS guidelines currently say to bring that over your head and fold it across the front so that the inside is now on the outside. Then steady that with this hand here that's still holding the glove, and if at all possible, go around to the back and undo the bow. Then bring your hand round here so that you're only touching the bit on the inside and fold it over and then roll it all down. You've got your gloves, you've got the inside of the apron all contained so that the inside is now on the outside. Then you can get rid of that. Now there is a slight alteration to that if you have come to the point where you're taking your personal protective equipment off, but some liquid, some water, maybe from when you're showering, someone has got inside your glove. In that instance, you still take them off in exactly the same way, but before you take the apron off, you go and you wash your hands using the NHS technique. You dry them, and then you go through the procedure of taking it over your head, because you do not want to be touching your head with a hand that the water has got into the inside of the glove. Regardless of whether you had to wash your hands in between taking the gloves off and taking the apron off, you still need to wash your hands again after you've disposed of the apron and gloves completely. So you may have to do it twice in the process if you had wet gloves to begin with, or you may just be doing it once in the process after you've taken the apron off, but you must wash your hands after the apron is disposed of. Thank you.